Thank you so much for joining us today. This is a happy event, and we're excited to share news with you about the organization. And I'm David Johnson. I'm the president of the board of Crisis Connections, and very grateful to be part of an organization that is doing 24/7 the important work, the front line work, often making the difference between life and death. I have been working in behavioral health in King County for 45 years, and I've been a licensed mental health counselor throughout that entire time. Uh, in the last 33 years of my career, I was CEO of psychiatric hospitals and mental health centers. I'm known for my respect for the dignity of people with serious and persistent mental health and substance use disorders. And I've initiated a lot of things to empower clients and patients. I'm known for also being a real ally for the families of those with mental illnesses. I see the families as the primary fundamental caregivers throughout the lifetime. I'm also known for my very early work on the integration of primary health care and behavioral health care, and also the implementation of mental health for infants and early childhood clients in King County. I have also been very much a proponent of trauma-informed care and have done a lot of work through the years with legislators at local, state, and national levels, setting policy that promotes resiliency and recovery. And then I've served on many task forces that have turned those policies into vibrant programs. I have served as president of the Washington Council for Behavioral Health and served on the board of the National Council for Behavioral Health. But I'm happiest being here at Crisis Connections at this time. And Michelle, we're so grateful that you took this position as CEO. We're so delighted to have you. Tell us why you chose this position at Crisis Connections at this time.
Well, and I'm just honored to have been appointed and chosen for this role. As you're aware, I've been involved off and on for 30 years with Crisis Connections. I started my career as a mental health professional, so I interacted with the crisis line supervisors. I was one of those folks that saw clients that were been assigned to see a crisis counselor after calling the line. I've been on the board a couple of times. I was on staff as well for 5 years at the turn of the century. And one of the things that I had done during that time was to work with Kathleen Southwood, the executive director at the time, to launch the 211 program. So this organization is really deep in my heart. And it is because our staff and volunteers do extraordinary things every single day. We are the place that people can call for a safe person to talk with. Very few places in our lives do we have the opportunity to have somebody that will listen compassionately to you, wherever you're at in life, 24 hours a day. So if it's 3 a.m. or 3 in the afternoon, somebody is having a concern around feeling anxious, there is a line they can call for us. If it's a teenager in Renton who is being bullied online and would like to talk with somebody around that, we have the Teen Link line. You can also chat. There's all sorts of different ways that folks in our community can be able to have a safe, compassionate place, really focus on reducing their distress and connecting them to additional services. And that's such a gift in this community. And again, so rare that there is a resource out there that has such a fundamental basics of being able to serve anyone at any time who really just needs to be able to have a moment to be heard and to feel like they matter. And that's really something that is incredible and why I want to continue to be part of that mission and to be part of this organization.
Well, your mission focus is impressive, and your clinical work through the years. I knew you many, many years ago at the beginning as well. And to have your combination of deep empathy and compassion and caring and smart business sense is a real boon to the organization. Past year and a half, COVID been a huge impact on the globe. And how has Crisis Connections stepped up to help meet the needs?
Well, yeah, we are still in the midst of a public health, a behavioral health crisis. And realistically, it's going to be a while before we really start to recover, particularly in the community having been traumatized in so many ways. So, Crisis Connections, our staff and volunteers, they're on the front line of what is happening emotionally in our community. So we immediately saw an increase in people calling our phone lines, reaching out for help. We are seeing a higher level of acuity. People are calling with much greater level of distress, including increased suicidal thoughts, depression, anxiety. We all know that many folks are isolated. Many folks who maybe have been struggling with substance abuse or use are relapsing. So our volunteers and staff on the front lines have seen exactly how much pain there is in the community. So we have seen in some places, in some of our programs, a tripling of the number of calls that we're receiving. Prior to COVID, we were receiving about 700 to 800 calls a day. We're now pretty much standard, receiving about 2,000 calls a day. And so that gives you an idea of the volume of need out there. And the organization really stepped up. Very few people may realize that when you call the state's COVID hotline to get information, you're actually calling one of our call centers, you're calling our staff. So we're very honored to be able to have partnerships with the State Department of Health and other entities to be able to provide information to people in our community who are distressed, who need resources around COVID. So we have increased our lines so that we can assist more people, but also have opened up targeted services around COVID so that we can be there at the front lines to help people get connected to resources, whether that's mental health support. We know that food insecurity out of COVID has gone way up. Before COVID, 1 in 10 families in this region had reported that they were food insecure. We're now at 3 to 10. And so we're helping families get connected to resources like food, rental assistance, and so forth. So we have had to expand because of COVID very quickly. And again, we do expect that we will be responding to community needs around COVID for a very long time.
Well, in my 45 years in the business in King County, I have relied on Crisis Clinic and then Crisis Connections all throughout, and have just loved the organization, and so impressed with what happened during the years that Kathleen was the executive director, and then with Allie in the lead position, and now with you. It's a time of great transition. We have these 2 new locations, these beautiful sites in Renton and downtown Seattle. We have more programs than ever, and a lot of change in the system coming up very quickly. What do you see as next steps for the organization?
Well,
and why should people contribute to help support?
Exactly, and continue to help us grow and meet those needs. So this is particularly an exciting time to be rejoining Crisis Connections, in that there are some fundamental shifts that are happening, positive shifts in people's ability to access behavioral health and to make it simpler for people who are in need or concerned about a loved one. So for example, one of the big shifts that's happening is going to be the rollout next year of a 988 dialing code. So I mentioned before that there's a dialing code 211 that was launched many years ago to help people get connected to human service resources. So nationally, 988 will be turned on July of 2022. And it basically is a shortcut for people to be able to access behavioral health support, whether it's they need to talk with someone because they're having suicidal thoughts, anxiety, any issues, or you have someone in your life that you're concerned about. So the opportunity with 988 is multiple. One is, like I said, it's an easy to remember number. So right now we are one of the providers of the National Suicide Prevention Lifeline. Basically that 10-digit number will be transferred over to 988. So again, much more accessible. 988 also promises to be able to create better accessibility through all the other resources. So Crisis Connections is an open door, that first stop. There's no wrong door with us. Call us, we'll connect you to the right resources. 988 will make that even easier. A couple other things that we're really excited about. One is, because this will be a national rollout, there's more opportunity to take away the stigma of asking for help. And some of the things that we're seeing now, particularly because of COVID, is around more of the acknowledgement that having mental health issues, anxiety, depression, things like that, you cannot go through life without knowing folks, even for yourself, that have experienced that either episodically or chronically. So the idea that there is something called 988, which will increase the conversation, the dialogue around it's okay to get help, and it's okay, just as if somebody had diabetes or a heart condition, to have something along those lines of mental health, a substance abuse issue, that there's help there and it's okay. So destigmatization would be really important. The last thing is a lot of conversations around police reform and making sure that we are sending police officers to the calls where a gun and a badge, it's a law enforcement issue. And that will be very helpful to law enforcement to be able to know that there'll be a line for 911 for law enforcement emergencies. And I think that 988 will take a lot of pressure off of the 911 system, because many situations that people call 911 for are actually really more of an emotional support issue, a behavioral health issue, even a public health issue. And let's make sure that we are using the resource of law enforcement to enforce the law, and that we are really approaching all other issues as truly a public health issue. So we believe that 988 is really going to go very far in addressing that issue.
Well, really exciting times, important changes coming up, and we appreciate your attention today, and we hope that you will be moved to help us out so that we can be our very best in the future.